clinical reasoning, evidence-based practice, and the scientific method. Learning objectives. Number 1. Identify clinical reasoning strategies. Number 2. Discuss clinical reasoning process. Number 3. Identify reasoning errors. Number 4. Define evidence-based practice, EBP. Number 5. Formulate clinical questions. Number 6. Find and appraise evidence. Clinical reasoning. Number 1. Process of thinking logically about patient care. Number 2. Involves generating hypotheses, collecting data, making conclusions. Types of reasoning. Number 1. Deductive. Links evidence in a linear fashion. Number 2. Inductive. Collects evidence, increases probability of truth. Number 3. Abductive. Generates and modifies hypotheses. Common reasoning errors. Number 1. Logical fallacies, for example, post hoc ergo propter hoc. Number 2. Cognitive biases, for example, confirmation bias. Evidence-based practice, EBP. Number 1. Combines best available evidence, clinical expertise, patient values. Number 2. Steps: ask, acquire, appraise, apply, assess. PICO framework. Number 1. P. Patient or problem. Number 2. I. Intervention. Number 3. C. Comparison. Number 4. O. Outcome. Scientific method. Number 1. Seeks objective, measurable truth. Number 2. Controls biases. Number 3. Steps: question, hypothesis, experiment, analyze, conclude. Deductive reasoning example. ADTO model. Number 1. Assessment diagnosis. Number 2. Diagnosis treatment. Number 3. Treatment outcome. Inductive reasoning example. Collecting patient data to support diagnosis. Abductive reasoning example. Modifying treatment based on patient response. Logical fallacies. Number 1. Post hoc ergo propter hoc, assuming causation from sequence. Number 2. Ad hominem, attacking the person, not the argument. Cognitive biases. Number 1. Confirmation bias, only using supporting evidence. Number 2. Hindsight bias, seeing events as predictable after they occur. Critical appraisal. Number 1. Essential for valid EBP. Number 2. Involves assessing the quality and relevance of evidence. Diagnostic reasoning. Number 1. Combined symptoms, history, physical exam. Number 2. Uses deductive reasoning to diagnose. Bayesian reasoning. Applies probability theory to update beliefs based on new evidence. Symptom modification approach. Number 1. Tests interventions to see if they change symptoms. Number 2. Reduces symptoms and improves function. Patient-centered care. Number 1. Involves patient values and preferences. Number 2. Improves treatment adherence and outcomes. Clinical expertise. Number 1. Developed through experience and practice. Number 2. Integrates knowledge, skills, and patient interactions. Review and practice. Number 1. Apply reasoning strategies to case studies. Number 2. Continuously practice critical appraisal and hypothesis testing.